Okay, here is a case that we did all-on-X treatment or full mouth reconstruction with dental implant. Came to us, he had infection, some pain, chronic sinusitis on the right side that for years were seeking treatment and no treatment was successful. You can see on the right side after everything was done and he got his final teeth and a smile. What a drastic difference in not just the teeth part but his look. This is the panoramic view of his first CT scan when he came to see me after was seen by his general dentist, Dr. Lamke. First thing I saw is that an implant upside down in the sinus, which probably was positioned here and then moved upward. But unfortunately, the dentist who treated this ignored it and made a bigger crown on this one implant and left that implant with the abutment in the sinus for years, and patient was not aware of this situation. Also, I saw on all the bottom implants had very bad bone loss, infection, gum disease around each one of these. Chronic sinusitis on both sides, and basically lots of infection. So our first treatment was to clean out, especially the right sinus, all the bad implants to get a healthier bone and gum tissue in the first stage. So our first plan was to remove all the posterior implants and the bad teeth and bone graft these sites to be able to reconstruct it later. Now, this is a 4 months healing after all the posterior implants cleaned out and the sites were grafted. We got rid of the sinusitis. The sinuses now were clean. We had relatively good bone, and now we could proceed with our all-on-X treatment, or basically now teeth in a day procedure. Here is the post-op after we removed all the remaining teeth and we placed dental implant. When we do this teeth in a day treatment or all-on-X, we place our implants in areas that have the best bone, and we also can angle the implant to be able to position them in the best location with the best angulation. So when the teeth are assembled and sit on these implants, they have the proper angle and the best biomechanics. For example, here we used a little bit short but wider implant because the sinus was low, but we had a good width of the bone because previously we grafted this side, so we put a very stable implant on the posterior region here. These are the permanent teeth sitting on the implant after 4 months of treatment. You can see that the teeth are sitting right at the gingival margin without any gap. The smile line is high, so when patient smiles, only this part of the teeth will show and has a very natural look to it. This picture, you can see even with a very wide smile, you only show the teeth at the gum margins, which this is cosmetic part of this all-on-X or full mouth reconstruction with dental implant therapy.